Hey, so welcome to the THMA Professional Development presentation. This is October 1st, and we're excited to have Kailey Walsh here. Kailey has been a medical esthetician for 2 years. She works at Dermapure, Ottawa downtown and is the medical assistant for Corey Akinsoya. Um, Kailey was going to be at our symposium in November in Halifax, and she wasn't able to come, so I asked her if she would present her presentation for all of you so that you guys can take advantage of her expertise. So I will let you take it away.
Awesome. Thank you, Tracy. So, like Tracy said, I'm Kailey. Tonight, we're going to be talking about enhancing aesthetic outcomes with the use of chemical peels in the treatment room. So, my name is Kailey. I am a medical esthetician here at Dermapure, Ottawa downtown. My focus is on skin quality and skin health treatments. I'm also a medical assistant with Corey, who's our nurse practitioner here, who you guys know. I also get to go globally with Corey to do trainings and presentations on various topics in aesthetics, and I'm also a medical assistant with THMA here in Ottawa. So, tonight we are going to be explaining how chemical peels work at a cellular level to revitalize the skin. So, going back to basics a little bit, we're going to be exploring commonly used acids and how to choose the right agent. So, we're going to be going over the different depths and how to choose the right peel for each patient. And then also understanding how chemical peels and devices can work synergistically to optimize aesthetic outcomes in the treatment room. And lastly, demonstrating how chemical peels can very easily be integrated into our patients' long term treatment plan to support skin health and maintain results over time. All right. So, I believe that chemical peels are so undervalued in aesthetics. I think that they are such an amazing treatment, especially for our first time patients. It's such a great introduction into the world of advanced aesthetic treatments. I find our first time patients are often a little bit scared, a little bit hesitant, and this seems to be the least scary option as long as you are properly explaining to them that this isn't like what they see online. It's not going to be a full face shedding like a snake or anything. They're also super quick, they're affordable, so it's an amazing way to build trust with your patient and actually open doors for future treatments. Chemical peels are also super versatile, adaptable, and clinically multifunctional. They treat such a wide variety of skin concerns, everything from acne, pigmentation, including melasma, fine lines, wrinkles, texture, scarring, and they can actually treat so many things in one session. They're also super customizable, so it depends on the peel you're choosing, so the acids, the number of layers that you're applying on the skin, the time that you're leaving the peel on the skin. It's so versatile and you can adapt it to each patient. And this actually allows us to treat super low and slow for our first time patients who, like I said, are typically a little bit more scared, a little bit more hesitant. And then they have minimal downtime with visible results. So when we talk about a superficial peel, there's actually pretty much no downtime, I would say. And then it's when we get into our medium depth peels that there's a few days of peeling or flaking. Now, I will say it is very important to let your patient know that peeling does not mean results. It depends where we catch the skin in that cell turnover cycle. So if they don't experience peeling, they're still getting results, they're still getting that exfoliation at a deeper cellular level. These are my results from just one Vivier Jessner peel on a Fitz 6. This is just to show how powerful chemical peels are. Here we were treating some PIH as well as some texture there on the chin, some congestion. And her results after one peel were so amazing. They truly are so powerful and they can do so much. They can give you amazing results, either that be as a standalone treatment or in combination with something else. Now, going back to basics a little bit, I do think it's important. How do peels truly work at that deep cellular level in the skin? So we know that peels, basically, they break the bonds between those dead, pigmented, damaged skin cells. They kind of dissolve that glue holding them together in order for them to come up to the surface quicker and be shut off a lot easier. This controlled injury is what is signaling to our keratinocytes in the basal layer to proliferate. So it's that cellular renewal. In the case of a superficial to medium depth peel, this mild inflammatory response is also stimulating our fibroblast activity for collagen and elastin production, which we all love. And a lot of peels can also regulate the melanocytes by inhibiting tyrosinase activity. Tyrosinase being that enzyme here that is responsible for pigment production. So by stopping that, we are slowing down melanin production. These are going to be our acids like lactic acid, glycolic acid, resorcinol, and so many more. Peels can also have an antibacterial and comedolatic effect, whether that be direct or indirect. We know that peels are already lowering the skin's pH, and this is already creating an environment that is much less favorable for acne causing bacteria to grow. And then we have our acids like salicylic acid, which is my absolute favorite for acne. This one is going to have a direct antibacterial effect on the skin. This is our lipophilic acid. So it's directly penetrating into the follicle to dissolve any oil, sebum, keratin plugs. It can also calm any inflamed papules, pustules, and it's going to regulate sebum production over time. This is what makes it the best option for acne, in my opinion. But then we can also have something like a glycolic acid that is a small molecule that is having an indirect comedolytic effect. By being so small, it can penetrate super deeply into the skin to normalize the keratinization process. And this is preventing any buildup of dead skin and blockages in the follicle. So it's targeting the root of the problem and preventing anything rather than correcting, like something like a salicylic acid. So in turn, with our chemical peels, we are exfoliating the skin, which is causing, by speeding up cell turnover. We're boosting collagen and elastin production in the case of our in our medium to deep depth peels. And then we're also regulating sebum production over time. We're fading pigmentation or actually preventing the formation of new pigmentation. And then we're also enhancing overall glow and radiance for our patients by smoothing out the texture of the skin. Now let's go into some commonly used acids as well as the different depths. I will say that myself in clinic, I only work with superficial to medium depth peels. Here at Dermapure, we use the skin ceuticle peels, so the micro peel, the gel peel, also the Vivier Gessner peel, which I've talked about, which is my favorite, and then the Functional Lab glycolic acid peels. Our superficial peels are the ones that are targeting the epidermis, mainly that outermost layer of the epidermis, so the stratum corneum. Like I said, it's going to go in, dissolve the glue that's holding together the dead skin cells, and remove that outermost layer of dead skin. So it promotes a regeneration of new, fresh, healthy skin cells to even out the tone, minimize very mild pigmentation, improve any texture, and also improve acne. These are going to be our enzymes. So those little Pac-Mans that eat away at the dead skin cells. your AHAs like lactic acid, glycolic acid, mandelic acid, and then your BHAs like salicylic acid. And then our medium depth peels. Sorry, I do also want to mention that the superficial peels, when you do repeated superficial peels in the long run, it can really improve the barrier function. And these are going to be little to no downtime. So I find them to be the easiest addition into your patient's treatment plan. And then we have our medium depth peels. I do mostly medium depth peels because I do mostly gesture peels. These are going to treat the entirety of the epidermis and into the papillary dermis, depending on the layers that you're applying to the skin. This is something like your low percent TCA peel, your Jessner's solution. And this is where that controlled injury is stimulating collagen production, making it amazing for fine lines and wrinkles, acne scarring, deeper pigmentation like melasma. So I do this one quite a bit. And lastly, our deep peels. I won't talk about this one too much because we don't do it here in clinic, but your deep peels are going into the reticular dermis, something like a phenol peel, a high percent TCA. These are amazing for very deep wrinkles or very deep pitted acne scars. I will say, I do think that there are better options out there for these concerns that are going to offer you less downtime. Now we get into the good stuff, the combination of chemical peels and devices for optimized treatment outcomes. When we are combining these treatments, we are really offering a multi-layered approach to overall skin rejuvenation. Think of it like resurfacing a wall. The chemical peel is going to smooth out, even out that top layer, get rid of any blemishes or marks, and then your devices are strengthening the foundation underneath. So think of it like priming and reinforcing. You're not only targeting both superficial concerns in the skin, like dullness, scarring, acne, pigment, or whatever it may be, but also deeper concerns like laxity, wrinkles, scarring. You're also going to see an improved efficacy in your devices because by removing that outermost layer of dead skin cells, of corneocytes, you're allowing a much deeper penetration of your lasers, your microneedling, your IPL, and a much more uniform absorption of that energy, which is going to offer your patient faster and more visible results. So they have a very synergistic effect that is allowing us to treat a wider range of concerns and actually achieve better results that are going to last and give that wow factor. We are not looking for a quick fix here in aesthetics. Starting off, I want to talk about my favorite combination of all time, which is Jessner peels and microneedling. This is such an amazing combination for acne, acne scarring, PIH. Typically, those do go hand in hand. So for this, the Jessner peel is going to exfoliate the skin, disrupt melanin production by inhibiting tyrosinase activity, promote an even melanin distribution through skin renewal, through that cell renewal, and also reduce any acne causing bacteria and oil buildup on the skin. And then you have your microneedling. So your collagen induction therapy is going to create micro injuries in the skin, as we know, to stimulate fibroblasts for collagen production. I like to explain microneedling to my patients in a way that is microneedling is kind of manually breaking up that scar tissue and then stimulating collagen production to sort of fill in those textural irregularities. It also enhances the absorption of your topical products, especially post-chemical peel. It is regulating your melanocytes, also regulating sebum production over time, and it actually reduces inflammation in the skin as well by increasing that blood flow. So together, your peel is prepping the skin very, very well for a more effective microneedling. And it's targeting, like I said, those surface level contributors to acne, like oil, buildup, bacteria. And then your microneedling targets that deeper structural issues like scarring, inflammation, and sebaceous gland activity to give those long lasting results. So I always obviously like to treat the active acne before going in with microneedling, and this is where this combo is super good. It is safe to do on all skin types. Of course, for your Fitzpatrick's 4 to 6, you do want to make sure that there is no history of keloid scarring. Be cautious with your needle depths as well. Maybe be a little bit more conservative at first, and then make sure that the skin is properly prepped and primed with products prior to treatment. Talking about products, super, super important. I always say that products are 80% of the battle and your treatments are about 20%. You cannot expect to see great results without using the right at-home care. So with this, a tyrosinase inhibitor is essential. That is the word of the night. My favorite one to use here would be an azelaic acid because not only is it going to prevent pigment production, it also kills acne-causing bacteria and reduces inflammation and redness. It's also going to gently exfoliate the skin. This is such a great option. I love this acid, and my patients love it too. And then a vitamin A or a retinol alternative if your patient can't handle a retinol, just to speed up cell turnover, amplify your results. And then, of course, a vitamin C, which is a non negotiable, alongside an SPF, of course. Here in clinic, we use SkinCeuticals. So I will say something like the Silymarin from SkinCeuticals is ideal in this case to not only target the acne, but also protect and brighten the skin. All right. So in this case, as always, we're prepping the skin with our products 4 weeks prior to treatment. And then I'd go in with 2 Jessner peels. All of our treatments are going to be 4 weeks apart. So your 2 Jessner peels, my typical is to go in with 2 passes of that and then top it off with a retinoic acid to amplify the results. Of course, if after our 2 passes of the Jessner peel, you're seeing a lot of erythema on the skin or your patient's sensation is at a 4 or a 5 out of 5, just leave it at that. But I typically don't have an issue doing all 3 passes. So you'll do 2 chemical peels 4 weeks apart. And then after that, 3 sessions of microneedling. Rule of thumb here, your needle depth at a 1 to 1.5 millimeter, and you can actually go 2 millimeter on that scar tissue. So 4 weeks apart for those. And then for maintenance, you want to do a Jessner peel a few times a year. My favorite would be to do it as the seasons are changing because that's typically when the skin freaks out a little bit, like mine is doing right now, unfortunately, or kind of as needed. And then microneedling 1 to 2 times a year for that. Now, these are some amazing results that I got doing this combination. So we did the exact protocol there, 2 Jessner peels, followed it up with 3 microneedlings. So it helped a lot with the active acne, a little bit of scarring, the PIE in this case. So the patient was super, super happy with these results, and so am I. And I'm actually seeing her for her chemical peel in a week as well. All right, the next combination is something that Corey and I have been doing quite a bit here in clinic as well. We love it. This is amazing for melasma, especially melasma in darker skin types. It is our Jessner peel and Picosure combination. So in this case, again, your peel is going to exfoliate the skin. It's going to regulate melanin production. And the salicylic acid does also have anti-inflammatory properties to reduce inflammation, which is one of our components of melasma here. And then your Pico, this is going to break down the pigmentation. I like to explain Pico to my patients. I use this example of think of your pigmentation as a rock. The pico laser is going to break it up into dust for your body to get rid of naturally through the lymphatic system. In this case, we are doing only our melasma setting on the affected areas. Doing that entire pass for skin revitalization might actually exacerbate the melasma. So although we're not directly using heat with this laser, the friction can actually cause heat and inflammation in the skin. So you can go in with that overall pass at the end once everything is treated, but I wouldn't do it in combination with these treatments. Now, of course, going back to our products, super, super important. Ideally, having your patient on a pigment suppressor like hydroquinone, a prescription of 4%, it is ideal. This would be a morning and night product to be applied on the affected areas. Now, we want them to use this 4 weeks prior to treatment to prep the skin and discontinue the use 5 days prior to treatment to avoid any irritation. And then in the case of the peel, stopping it 7 days after the chemical peel as well. And super important here, you want your patient to continue onto the hydroquinone for 1 month following the treatment series. Of course, hydroquinone is not a long-term option. So during our off cycle, you do still want them to be on these pigment suppressors. My little trio that I love, again, SkinCeuticals, is going to be the Discoloration Defense. This has niacinamide, kojic acid, tranexamic acid. It's so amazing for pigmentation. They'd be using this morning and night. And then the Floritin Vitamin C, which is again a non-negotiable here to brighten the skin. This one actually directly targets pigmentation. And then lastly, the Metacell Renewal B3 moisturizer from SkinCeuticals. It has niacinamide in it, so it's super good for pigment and inflammation. It also gives such a good glow. Patients love it. And then, of course, a vitamin A or a retinol alternative here is super important. In this case, I actually prefer a retinol alternative. In Corey and I's protocol, they actually have to be using the cell cycle catalyst from SkinCeuticals. So this is going to act in the same way as a retinol, where it's energizing the cells to promote cell turnover, but they can actually use it right up until the day before treatment. And resume it like 3 to 4 days after, as long as there's no irritation. So it's a super good option. Now together, these are, you're enhancing your penetration and effectiveness of the laser by offering a fresh canvas to work on with the chemical peel. And our main benefit is that we're suppressing melanogenesis with the chemical peel prior to going in with the laser. This is going to avoid any risk of PIH or any risk of exacerbating that melasma, and they'll be able to reach their end goal with less sessions, which is always ideal. So here again, you want to prep the skin with products 4 weeks prior to treatment and stopping the use about 5 to 7 days prior to treatment. Gesture peel, just like last time, 2 passes, top it off with your retinoic acid as long as you're not having any issues with erythema or discomfort. And then 4 weeks later, you're going in with 3 PicoSure treatments. I say 3, it might be more. In this case, we really have to treat low and slow. So do as many sessions as necessary, but you're going in with your flat lens at a 10 millimeter spot size, 2.5 hertz, and the lowest energy. And you're only going to go over the affected areas. Like I said, at the end of the treatment session, you can do an overall pass with your focus lens for skin revitalization, for texture, pore size, glow, but really during this, you want to focus on that melasma. As maintenance, doing a gesture peel a few times a year or as needed, and then your pico laser once a year, twice a year if you're extra like Corey and I, really depends. And again, 4 weeks between each treatment. All right, Now, how can we easily integrate chemical peels into treatment plans for long-term skin health and maintenance? I love doing chemical peels seasonally to correct, enhance, maintain. With the right patient, these are actually safe to do all year round, even throughout the summer months. Of course, you do have to have the right patient and you have to have trust in your patient that they're not going to be going out sun tanning and that they're going to be super diligent in applying and reapplying their sunscreen. But this is awesome to do all year round because it's a quick treatment and there is minimal downtime. They can also be very easily incorporated into a basic facial as well. Another way of doing this is throughout a series of injectable treatments or actually during their quarterly toxin treatment as well. This is going to give your patient a true 360 approach to skin rejuvenation. It's also a super easy way to convert your strictly injectable only patients to trying treatments, trying skincare, and getting into that side of aesthetics as well. So when we look at doing chemical peels throughout the year, during the winter months, January to March, you can go in with your medium depth peels. This is where you're looking to do a treatment series or combination therapy ideally, and you're looking to renew the skin and correct. Then in the spring, depending on your patient, depending on the weather, their lifestyle, go in with a superficial to medium depth peel. This is mainly for maintenance, but also to brighten the skin to be ready for summer. Now in summer, you're mainly doing superficial peels. I will say I've done medium depth peels in the summer as long as I have had full trust in my patient. I know my patient, and I know it's going to be safe to do. But typically, these are maintenance sessions only. And then we go into the fall months, go back into your medium depth peels. You're looking at doing treatment series or combination therapy. You're looking to prep the skin for laser season and also correct any sins of the summer. You're looking to correct some sun damage here, most likely. All right. So when we're talking about injectables, sorry, one of my favorite things to do and something that Corey and I have been doing quite a bit as well is the combination of chemical peels, skin boosters, and biostimulators. So Corey and I typically use the Restylane Skin Booster Vital Light and then Sculptra for this. So your chemical peel is going to minimize pigmentation, improve tone, texture. We're really working on those surface level concerns. And then you have your Sculptra that's going to boost collagen and elastin, target volume loss, support, lift. And then your Skin Booster is boosting hydration and glow. This is that step up that's going to give your patient a wow factor. So going back to the example of resurfacing a wall, we can do everything under the surface to enhance structure, support, but if we're not addressing those surface level concerns and smoothing out that wall, making that wall look good without any bumps or blemishes, it's just not going to give the full effect that your treatment is capable of giving. And I promise you, your patient is going to love their results when you're giving that 360 approach. So here our protocol is going to look like this. You're going to be seeing your patient every 2 weeks. So we start off with the injectables. You're doing a skin booster here, 2 syringes, and then 2 vials of Sculptra per session. Your Sculptra is going to be for that ligament lift and skin quality. And then 2 weeks later, doing a superficial to medium depth peel. This is going to depend on your patient's skin type, their skin condition, concerns, their lifestyle, kind of assess what would work best for them here. And like I said, you're seeing them every 2 weeks and you're going to alternate each treatment for a total of 6 sessions. And then, of course, one of the easiest ways to implement chemical peels into a treatment series is going to be doing them at your patient's quarterly toxin treatment. This is going to give full face rejuvenation once again. So you're targeting the dynamic lines with your toxin, of course, for those fine lines and wrinkles, but also smoothing things out with your chemical peel. In the case of a superficial peel, it can be done the same day. If you're going to do a medium depth peel, I would space them a week apart, but it really depends on if you're doing a self-neutralizing peel or something that you're going to have to neutralize. In the case of a self-neutralizing peel, I'd wait between them because what happens is you're going to do your peel, then when your patient does the toxin, it's just going to wipe off the peel. So it's just best to space them out there. But if you're doing something that's going to be neutralized in clinic, absolutely do it the same day. And it's a super easy way to, like I said, convert those injectable only patients to doing skincare, doing devices, doing treatments. Awesome. So thank you so much for listening, you guys.
Slay!
That is all from me today. Thank you so much. Do you guys have any questions or anything?
Thanks, Callie. I'm going to thank you very much for taking the time out to share your
Of course.
expertise.
Thank you for having me.